Welcome friends. Today in this video I will talk on emergency drugs. That means the medicine which should be available in a hospital to meet the emergency condition and so that patient can be treated properly. The list includes some injections, some tablets and few respules. It starts with injection Diclofenac and injection Tramadol. These two are painkiller. Diclofenac is peripherally acting and tramadol is centrally acting. Then injection pantoprazole and ranitidine, these two are systemic antacids. Injection hydrocortisone and dexamethasone, these are steroidal drugs and can be used to treat several kind of allergic reaction and anaphylactic shock. Injection darbepoetin is used for asthma patients. Then injection rotavirine has several used from gastrointestinal pain to pain in the women for menstrual problem, etc. Injection ondansetron, injection promethazine can be used as a antiemetic effect. Injection furosemide is used to reduce the hypertension and it can reduce the volume of the blood due to its diuretic effects. Then injection metoclopramide it is used to increase the gastric motility, and injection labetalol is used in pregnancy to reduce the high blood pressure. Injection tranexamic acid is used basically to reduce the bleeding or to stop the bleeding. Then injection pentazocine is a centrally acting analgesic drugs. Then injection atropine is a anticholinergic drugs and has several use it also prevents nausea, vomiting. Injection calcium gluconate is used to increase the level of calcium in the body as well as to prevent the toxicity of potassium and magnesium. Injection noradrenaline and adrenaline, it is used to increase the blood pressure in case of hypovolemic shock or etc. Then injection paracetamol, everybody knows it is antipyretic, and injection multivitamin used to increase the energy of the patient for to minimize the weakness. Injection tetanus toxoid, it has several used from cutting a hand or etc. and injury to several kind of things. In case of snake bite, injection anti-snake venom along with neostigmine is used, and in case of animal bite like dog bite, cat bite, etc. In case of anti-rabies vaccine, and along with that equine is given. Equine is given for those patients having animal bite and bleeding, evidence of bleeding, and if there is no evidence of bleeding, only ARV is given. Then magnesium sulfate is used for pregnant women. I will discuss later on in details. Then oxytocin is also used for pregnancy, and sodium bicarbonate is used in case of systemic acidity. Injection lorazepam, it is a kind of sedative hypnotic drug and can also be used in epileptic seizure as well. Then injection nitroglycerin and injection enoxaparin, this can be used in cardiovascular risk patients. Injection phenytoin is also used in epileptic seizures, and injection hemoxil is a plasma expander, and injection amiodarone is also used in epileptic seizures and cardiac kind of problem, arrhythmia like that. And potassium chloride is used to increase the level of potassium in the body. Injection mannitol and 25% dextrose can be used in where the level of sugar is low in the body, that hypoglycemia. And then 2% lidocaine is used for local anesthesia, for local any kind of injury or like that injections. Before that 2% lidocaine can be used. Then 3% sodium chloride is a hypertonic solution, it has several used. And then injection phenidamine is a antihistaminic and can be used in different kind of allergic reactions. Injection artesunate is used in malaria patient, and injection quinine can also be used in malaria patients and who are having several other complications, and quinine is also beneficial for anemic patients as well. Then injection true pladidoxime, it is used in organophosphate poisoning. Injection esmolol is used in before and after surgery in some cases, and several type of solutions like infusion, ingal lactate, sodium chloride, dextrose with sodium chloride, 5% dextrose, 0.5% sodium chloride, metronidazole. These are several use, and these are considered to be vital drugs. Injection flumazenil is used in overdose of benzodiazepine, and respules like salbutamol, budesonide, and duolin, that is combination of levosalbutamol and ipratropium bromide. These are used to treat asthma patient. Then antimalarial drugs like chloroquine, primaquine is used, and for high risk of cardiac patients who are having high lipid profile, tablet aspirin, clopidogrel, atorvastatin is essential. And for ischemic patients, cardiac pain, to reduce that one, isosorbide dinitrate is very useful drugs. Then detailed study of some important drugs like noradrenaline. It is used to treat any kind of acute hypotension, cardiac arrest, etc. And medicine is given in intravenous, intramuscular or subcutaneous route. The dose may be for pediatric 0.05 to 0.1 microgram per kg per minute for IV route, and maximum dose should be 1 to 2 microgram per kg per minute. In case of cardiac arrest, the dose is 8 to 12 microgram per minute IV route. So I am not going to discuss in detail about the dosage and the dose. And then it is also used in sepsis and septic shock, like beta blocker toxicity, calcium channel blocker toxicity, as well as in anaphylaxis. This is very important, anaphylaxis. So in case of anaphylaxis, the dose is given and repeated in 5 to 10 minutes interval, and if needed, and injection should not be given at the same time again and again. And if this is done, and then there is a chance of vasoconstriction. So to reduce vasoconstriction, you should not give injection at the same time again and again, and the needle size should be long enough, that should be at least ½ inches. Okay. Then dose should be accordingly body weight of the patient in case of children, and if the weight is 30 kg or more, you should give 0.3 to 0.5 mg, and in case of less than 30 kg, 0.01 mg per kg. So as per the weight, you can calculate the dose. Then hypotension associated with septic shock, I am not going to describe in detail. Then next is injection atropine. The dose is 0.4 mg per ml, and it is used in pre-anesthetic condition, sinus bradycardia, and organophosphate poisoning. Then dose 0.4 to 0.6, and it is also used in bronchospasm. It is also used in bronchospasm. The adult dose is 0.025 mg per kg, and it is diluted with normal saline and given in the duration 6 to 8 hours. Next, injection diclofenac. It is a non-steroidal anti-inflammatory drugs and used to treat any kind of pain, but care should be taken that maximum dose should not exceed above 150 mg in 24 hours. So you can give 2 injection of 75 mg in IV route or IM route as per your choice. Then injection dexamethasone 4 mg per 2 ml dose, and it is used in shock or inflammation or multiple sclerosis or cerebral edema. Then injection hydrocortisone, the dose is 100 mg and it is given in IV routes only, but it can be dissolved in normal saline, and it is used in asthma, skin allergy and autoimmune disease. Next is injection rotavirine. As you know, it is a painkiller and it reduces the spasm, and it is used in kidney stone pain, GIT pain and menstrual or abdominal pain. Then injection deriphylline, as I have told you, it is used as bronchodilator. And injection ondansetron, everybody knows that is used in vomiting, but it is a kind of 5-HT3 antagonist. It's very important. Its class is 5-HT3. 5-HT means 5-hydroxytryptamine. Then injection furosemide is a kind of diuretics, so it increases the urine output and reduces the blood volume. So as a result, it is used in hypertension, and dose is 20 mg per 2 ml. Then injection flumazenil, it is two use. One is to reverse the effect of sedation and anesthesia. The dose is 0.2 mg IV route and given over 15 seconds. And another use is benzodiazepine overdose, where the dose is 0.2 mg IV route over 15 to 30 seconds. Then injection metoclopramide, the dose is 0.1 to 0.15 mg per kg body weight and given 3 times in a day, and routes are IM and IV, but it is given in slow bolus injection over 3 minutes of time and used in gastroparesis, that is the feeling of fullness of GI tract or the belly after a meal, and it happens in case of diabetes mellitus patient. Next is injection labetalol, the dose is 5 mg per ml, IV routes is preferred. Then injection magnesium sulfate, it is used to control low blood level of magnesium. It widens it widens the blood vessel in the brain and improves the blood supply in the nerve cell as well. Then dose of magnesium sulfate in case of hypomagnesia, it is 1 gram IM route over in every 6 hours for 4 doses. And in case of toxemia of pregnancy, the dose is 4 to 5 gram. Then it is also used in acute nephritis and preterm labor. Then is injection calcium gluconate, the dose is 100 mg per ml and route is IM and IV. It is used to manage hypocalcemia, cardiac arrest, cardiotoxicity due to hyperkalemia or hypermagnesemia. So last one is sodium bicarbonate, 75 mg per ml, and the given route is intravenous. So it is used in systemic acidosis. So thanks a lot for your valuable time.